So you have two sheets here. One is to help, they're both to help with communication and translation of patient information. So you have the hygiene sheet. So when the hygienists are preparing for their morning huddle, they're already filling out some of what they can find out about the patient on this sheet. So it's a translation where they can enter information as they're doing it. Say the patient has a chief complaint, say that they have a cosmetic wish, what type of exam is needed by the doctor. It's kind of an overlay from huddle over into the day where you can kind of give the doctor at a glance what is needed for that exam, so you can go in wherever the doctor's treating and you can leave it for them on the back counter. So let's say that they're carrying a procedure, or they're in a part of the procedure where they can just stop and glance over. They can see how much time they have left in the appointment to get to the hygienist. So the hygienists are never waiting for the doctor, which is a huge issue and setback in many dental offices, because then now the hygienist is falling behind with her schedule and she has to rush with the next patient to catch up with her day. So that doesn't happen here because these help relay information that would usually be a time sucker for the hygienist and doctor communication. You have a treatment planning sheet. So basically you want to be able to, and legally you have to give the patient all options of what they can do, and it's up to the patient to pick their best option of what they would want for treatment. So again, this section here is capturing almost the same information where, what x-rays have you taken as a clinician preparing for that new patient doctor exam or full treatment plan exam. So you're kind of gathering all that information where the doctor at a glance can kind of look, get some information about the patient, personal, what's desired of the exam today, why did they come here, where are they at with their hygiene and what is needed, what did the hygienist assess them for, and then also any other collected information regarding individual teeth that the hygienist has collected, and then you can offer them the different treatment plans that you have here. So any other special notes, whether it be ideal, what they should get done, a high priority, that middle priority, and then the cosmetic. Or you have 3 different treatment plans in which they can do to get their treatment completed. So you can use these 3 crosses in 2 different ways. And then what's happened with this is the doctor will sign it and it's scanned into the record. That way you don't enter into the software 3 different treatment plans and it's confusing to look at a glance. You have the treatment plans in which was offered, so that's your legal record of that. And then in the software is just the treatment plan that they have selected. So and it's also a good reference where you can look back and the patient started treatment. Say they came in for cosmetic, what happens is they need to get treatment done before they can do some cosmetic work. So that gets lost in the sequence of treatment because it could take them a few months to complete treatment in some cases. So what happens is this is a good reference to look back at what was the patient's original desire. Did they come here wanting Invisalign and then they had to complete treatment first? So it's a good look back at the original start of their relationship with the patient.